I'm Dr. Rajat Goyal from I Plus Agra. I'm here to talk about the new generation's moxifloxacins, uh, for which many companies are like launching nowadays. For a newer generation moxifloxacin, actually what we are looking for an antibiotic now. We are basically looking for that it should be more effective by using it even lesser. So we require that the number of drops per day should go down and the efficacy should increase. And this efficacy can be increased by increasing the bioavailability and the retention of the moxifloxacin eye drops. So now the newer generation moxifloxacin eye drops are coming with the additive of xanthan gum, which usually increases the bioavailability and retention of the moxifloxacin antibiotic eye drops into the conjunctival sac, which in turn gives a better bioavailability and the minimum inhibitory concentration of the antibiotics increase so that we can cover more number of bacteria and the spectrum of the antibiotic also increases. It is like if the same drop is available for a longer time and can be used for a longer period and can be effective more for more number of bacteria, making the broad spectrum antibiotic even broader. So it can decrease down the side effects also and would be safer if we have to add other antibiotics and other antifungal eye drops according to the patient's need. Because of the increased bioavailability and the decreased number of drops using per day, it's like we usually prescribe moxifloxacin eye drops 4 times a day. And by using this newer generation antibiotic, which is with the xanthan gum additive, we can increase the bioavailability and decrease the dosage by twice a day only with the same efficacy. So it would be safer for the pediatric age group also, where we are more concerned about the side effects on the cornea. So I would prescribe a newer generation antibiotic that to what we are usually using moxifloxacin, and we are giving the patients a benefit of reduced number of drops per day that would decrease the side effects and the retention power increases, so the disease time also decreases. Like if the patient would be responding to an antibiotic 4 or 6 times a day and we have to use it for a week, then we can reduce it to twice a day and can get relief in 3 to 4 days itself. And in my practical use, I've been using this antibiotic for last like 6 to 7 months and been regularly using for corneal ulcers, bacterial conjunctivitis, sometimes for my post-operative and pre-operative antibiotics also, so that we can decrease the number of drops the patient we are giving to. Like in a post-operative patients, we are prescribing number of drops. Then for an antibiotic, we have to give 4 to 6 times, and we can reduce it to 2 times a day. So that will give a very good results for the patients that we are prescribing very few drops after the surgery. And for corneal ulcer patients, as there are very many number of drops I use, like we use dilators, we use sometimes pressure lowering, we use antifungals, even some antivirals, and we are very afraid of the secondary bacterial conjunctivitis associated or the bacterial part of the ulcer. So we can give this newer generation moxifloxacin with the xanthan gum additive, and just twice a day would be very sufficient, and the patient would be very happy so that the number of drops keep on decreasing. So I highly recommend this drop, and this would be a great change to the ophthalmology antibiotic spectrum, that even with the same antibiotic we are giving broader antibiotic spectrum for fighting more number of bacteria. So for this, I'm taking a good note, and I hope this video was informative. Thank you.